And for the second time in just days, the provincial government is meeting with Ontario nurses. This time, it's registered practical nurses who are at the table. And while it's a different group, the issues are similar to what other healthcare providers have called out.
It's time that the RPNs are treated more fair in the grand scheme of healthcare.
Though they have traditionally cared for patients with less complex cases, Tracy Holmes, a registered practical nurse, says the scope of practice and responsibilities for those in her profession have increased over the years, and in many ways they are now on par with registered nurses. Yet that's not reflected in their wages, explaining that RPNs are also facing longer hours, more work, and fewer breaks.
The pandemic has brought more light to that. Clearly, there is no staff in healthcare right now. There's such a shortage, and should the RPN group not have stepped up in this crisis, I'm not sure where healthcare would have been.
This afternoon, Unifor, which represents 4,000 Ontario RPNs, held a virtual meeting with the province's Minister of Health to address what they say is an ongoing healthcare crisis. At the top of the list, calling for a baseline wage across sectors and an end to a controversial government bill.
We wanted to talk about, first of all, repealing Bill 124, which is, limits, of course, compensation for many, many healthcare workers. And we wanted to talk about, a real pandemic pay, a recognition for all healthcare workers, particularly everyone that's working under those emergency orders.
Just last week, the Ontario Nurses Association, which represents more than 68,000 nurses, met with the Premier to discuss what leadership say is a staffing shortage, also calling for Bill 124 to be repealed. ONA told CityNews then Doug Ford did not make a commitment on that. Today, Unifor says Health Minister Elliott said no.
She clearly stated that they will not repeal Bill 124, that their government doesn't have an intention to do it. I didn't hear a real clear reason, just that they've made the decision that they won't do that.
Unifor says that doesn't mean they will stop calling for the bill, which overwhelmingly affects women, to be dropped. Unions argue it is one of the reasons why more nurses are leaving the profession and fewer are coming in.
Retention's got to be game one right now. I mean, we need to make sure nurses are respected. If anyone believes that nurses and, quite frankly, all healthcare workers are okay right now, well, they're just sadly mistaken.
And the Ontario Nurses Association says they are once again meeting with the Premier, though no date has been provided for that just yet. And we've also reached out to the Ministry of Health to ask about today's meeting. However, we have not yet heard back.